Thank you for that introduction. I also just want to welcome everybody to the webinar today. As you're aware, we'll be talking about how we can use assessment data to engage students in remediation. So before we get started, I'd like to cover an agenda just to describe what we'll be covering in today's webinar. So first, I'd like to provide you with a brief overview of Marian University College of Osteopathic Medicine, just to provide a little bit of context for the rest of the information in the webinar today. I'll then discuss some general considerations for remediation before we move forward, and then we'll dive into more specific information about tracking outcomes that would help us facilitate remediation efforts and engage students in that process. And then we'll be looking at remediation structures and support in three specific areas. Those are after a student fails a single assessment, after the failure of a course, and then when a student is struggling with specific concepts across the entire curriculum. I'll then describe some outcomes of these processes as far as our perspective goes and what we've learned from this information in these initiatives. I'll make some recommendations, and then finally, hopefully we can have a question and answer session so we can engage in some discussion around this topic. So first, I just want to describe to you a little bit about our curriculum here to, again, provide a little bit of a backdrop of the information that I'll be describing today in the webinar. We are a competency-based curriculum. I know many of you might be under a similar structure. If you're not, that's okay. We'll talk about competencies and outcomes fairly broadly as they relate to remediation, which I think would apply to all disciplines and all academic areas. We also have a systems-based or integrated curriculum here. And what that means is that students always have the opportunity to apply what they're learning in their biomedical courses and use that information and apply that in clinical settings. So for example, if they're learning about renal failure in a biomedical course, they will have the opportunity to apply that in a clinical exam setting or a simulation related to that same topic. And really, when we think about this, it's important for us to talk about our structure as far as being iPad exclusive as well. So we are electronic. It's important to note that because that does facilitate the collection and the reporting of our data fairly easily as I talk about that through this webinar. So some of you who are Scantron based, you're still going to have that information in this system, but it may not be as readily available. And then lastly, we involve key stakeholders in the assessment process at multiple intervals. And that's important for the remediation initiatives that I'll discuss today, because students and faculty have been involved in providing feedback regarding all of these reports and processes along the way. And they've really helped us shape the process that we'll talk about today. So next, I'd like to talk about remediation fairly broadly because their definition of remediation is fairly consistent, but we might think about it in different ways depending on our disciplinary perspectives. So I just wanted to talk about it at a high level just to provide context for the rest of the webinar today. So from my perspective, remediation is really the process of partnering with students to make corrections when they've moved off course or if they're unable to perform to standards or competencies or outcomes that we expect of them during their academic career. So this process involves self-remediation as well as facilitation by advisors, faculty members, course directors, assessment professionals, administrative staff, etc. So it's a very collaborative effort. And it can also involve working with committees such as a student progress committee. I know many of you probably have an entity similar to that on your campus or in your school. And then remediation works best in an environment that's really focused on what students learn and not really what we teach them. And I know that sounds simple. I know we say that a lot, but if we think about curricula, and if I think about our curriculum we deliver, we really do still focus on teaching a lot more than learning, even though we try to emphasize that learning component. So that's a continuous process of trying to focus on that learning aspect rather than just the teaching and the content delivery. So let's review some of the literature about levels of remediation before we move forward. So when we think about the student level, I've already mentioned self-remediation, and this can be self-remediation with or without instructor involvement. In a recent piece of literature that may go against a perspective that most of us may have, a recent study found actually larger gains and increased retention when students self-remediated without the help of an instructor. So what I want to take away from this is that significant gains can be made in the process of self-remediation. And again, that's dependent on the student. It's not necessarily going to work best for every student to self-remediate, but we want to be able to facilitate self-remediation for those students for which it works best. Secondly, the faculty level. This is intervention that is always paired with constant meetings, or I don't want to say constant, but regular meetings with a course director, with an instructor, with an advisor, some intervention from a faculty member at that level. So according to another study that really focused on what an ideal model of remediation would look like, it would involve multiple components that are listed here. So multiple assessments. So we want to make sure we are not just assessing students once or using a single assessment, but ensuring that we are using multiple assessments to gauge their learning. Secondly, diagnosis of problems and development of an individualized learning plan. So this is a very individualized and specific process for each student, has to be tailored to the student's level. Meetings with faculty that are regular and have meaningful feedback, reflection from the student about what he or she is learning. And then finally, reassessment and then confirmation of competence so that we know that student is ready to move forward. And then lastly, at the administrative level, this is really where it is escalated to give the student multiple support interventions. So this may include things like student affairs, counseling, tutoring. It also still includes self-remediation, and it still includes faculty intervention, but there are also other support services involved here as well. So now we'll discuss some of the specific elements regarding how we, in my institution, in my school, how we look at remediation and how we engage students in this process. So what you see on the screen is a snapshot of how we use ExamSoft to track learning outcomes. The image you see there to the right is a list of our discipline categories. So you're going to see a lot of medical related disciplines there. And that's just a snippet from our ExamSoft category structure. But we also track several other areas from each exam, both written and practical. So any multiple choice question, any rubric dimension that we use for more practical or clinical oriented assessments, each of those is designed to a category area within the system or multiple category areas within the system. So what you'll see in the list here, we track professional competencies. Those are competencies for practice. We track content areas for boards exams. We track systems. So when I say system, I mean things like cardiovascular system, pulmonary, etc. Discipline, which is the list you're seeing there to the right, and that's the example I'm going to use throughout the presentation today. We also track learning domains, so we will tag or track a question or a rubric dimension to the levels of Bloom's taxonomy, so we can track if a student is recalling things properly, but perhaps not applying information. And then the last piece you'll see here are the course-specific outcomes. So each faculty member, in addition to the first 5 on the list, each faculty member can track whatever he or she finds worthy of tracking within a given course to assess student learning. So it's important that I show you this process because this is really fundamental to our ability to pull accurate and timely data for remediation purposes. For example, if you look at the list on the right, the list of our disciplines there, let's say we'll just pick one out on biochemistry. When we pull a student performance report through ExamSoft, we can determine if students are struggling or excelling in that specific area simply based on how they're performing on that concept. And that can be on a single assessment, so a specific exam, or that can be across the curriculum, and we'll discuss each of those in just a moment. And again, this is med school specific, but you could make this list based on whatever your learning outcomes are for your students and whatever you would like to measure. So this could be related to any discipline or any academic area depending on the outcomes or the skills that you would like to assess and measure. So let's talk about that first level. Let's talk about remediation of a single assessment and how we facilitate that process and engage students in that process here. So remediation, if we're talking about this single assessment, the remediation would take place within a single course in this situation. So what you're seeing here on this slide is a strength and improvement opportunities reports that comes straight from ExamSoft. And this is provided to each student after each exam. Some of you may already be familiar with this report and you may use it in a similar way for remediation, but I just wanted to talk through this for just a moment. Our students use this primarily to self-remediate, though they may go meet with a course director to collaborate or engage with faculty members or an advisor to really understand any strengths or weaknesses they have in order to prepare for the next exam. So just to dive into the report a little bit here, what you're seeing here on the left is a report, again, from a single exam in a single course. What you're seeing, again, we're going to use the example of those disciplines. The green would tell a student that he or she is doing fairly well on these areas. Yellow would be caution. Red would be an area in which that student needs to remediate or really require some work for that student to get up to speed. The piece of the right is part of the report, but I wanted to highlight it separately because it's not related specifically to the disciplines. Rather, it is specific things or specific topics within that course that that course director wanted to track to gauge student learning. So it goes beyond the high level categories and gets fairly specific at the topic level. So in some of our courses, the way that remediation occurs is a course director would allow remediation of a single failure through taking a single exam for remediation. And typically a student can earn a score of up to 70 on that single assessment when they are retaking that exam. And this does vary a little bit, but that's pretty much the standard. And then in other courses, some students don't have the opportunity to remediate a single assessment, but they meet with the course director and advisor via discussion or remedial work that needs to take place before they move forward, even though they don't have that formal opportunity for another assessment. So this really varies. It depends on the size of the course, the length of the course, and the speed of the content. So for example, the report you're seeing here is from a course that runs only 2 weeks. And so in this case, a student would not have a chance to formally remediate a single exam. Rather, they would take that opportunity to meet with the course director or the faculty to remediate concepts, but not take a formal exam for remediation. But if you think about a course, one example would be anatomy that meets for 15 or 16 weeks. In that course, students do have the opportunity to take a formal remediation exam due to the pace of the content and the foundational element of what that content actually is in that course. So let's move on to remediation of a course failure. So So in this regard, we can run a category report at the course level, and it'll show a student how he or she is performing in relationship to the class. But it's really a report that pulls what you saw in the Strengths and Opportunities report. It pulls it across the full course rather than a snapshot at a single exam level. So what you're seeing here on this screen is a report of disciplines in one course with the number of items here, and then the group average. Now what you're not seeing would be a fourth column that would have the actual student that we are pulling the report for. It would have that student's performance in comparison with the group average, and that would be column 4 here. So when a student fails a course and that individual is referred to our Student Promotion and Academic Progress Committee, that student has to write a letter describing the failure and articulating what really occurred in that situation. And we use a report in addition to what you're seeing here, and I didn't really put it in the PowerPoint because of confidentiality concerns, but it includes all performance data for a given student, and that includes their complete academic record. So when they meet before the committee, they're evaluated not only on that single course failure, but they're evaluated on perhaps trends and patterns that have occurred in their performance overall. So that might include failures of a single assessment, which we just spoke about on the previous slide. It might include a review to make sure that there are no professionalism concerns. All of those pieces then become part of a review. So that committee really engages with students to attempt to find the best case scenario for remediation and really determine if it's a feasible option for that student, and hopefully configuring if the student could be successful on that remediation. And as many of us know, there are often many personal circumstances in addition to academic circumstances that contribute to a course failure. Typically, it's not only academic in nature. So in that case, the process for remediation would include not only academic components that we've discussed, but also things like counseling support, student affairs, tutoring, etc. So all those components that we previously discussed as administrative level related to remediation, that would come into play here. If a student does remediate a course failure and take a remediation exam, those are offered in the summer when our courses are not in session. So we have 1 month in which we don't have any remediations. And that would take place during that time frame. And if that would occur, the student is engaged with faculty and the course director via structured support for remediation. So any performance data related to that course would be reviewed. This type of report would be included to ensure that students are remediating the appropriate concepts and preparing for that exam the best that he or she can. And as that student meets with the course director multiple times in order to prepare for the examination, of course, expectations would be covered, as well as a discussion of these concepts that he or she would be remediating. Now, this, of course, is a single course failure. If there is an instance of multiple course failures, which sometimes does happen, the student may need to repeat the year or even face dismissal rather than remediating a single course. Those students wouldn't be able just to take a remediation exam in the summer. So the next level that I said we would cover is remediation of concepts. And while we can look at remediation of concepts within a single course, I think the greater opportunity here lies in the ability to review a student's understanding of concepts across the entire curriculum. And that's what exam soft reports allow us to do. So for us, this becomes really important when students are preparing for board study and they need to remediate a particular concept before taking that board's exam. If you aren't in a discipline that has a board's exam, I think this could still be applicable to things like capstone experiences. If you look at what you've measured across the curriculum, it's still relevant for any exam or any assessment that would occur prior to completion of a program. So if we think about it broadly in nature, that's important to note. So in our situation, students take a diagnostic exam when they're preparing for boards, and they receive a report that is tailored to that specific student. And that's divided by academic content areas that they will eventually see on their board's exam. So students use that data to self-remediate, and then they must develop a unique and individualized study plan in order to remediate any concepts they need to remediate prior to taking boards. During that process, the student remains engaged with faculty. They have to check in regularly regarding their study progress and any remediation that's required, and they cannot sit for boards unless they have completed that study plan successfully. We pair that boards data report with the report that you see here on this slide. And what you're seeing on this slide is created by our wonderful examination coordinator. And she pulls this data from ExamSoft to show students their average performance on all areas across our years 1 and 2 of our curriculum. So what you'll see here, again, we're going with the theme of disciplines, though it's far more extensive. This is actually a huge report that they receive. These are the disciplines here on the left. The number of assessments that have addressed this discipline, that's what's here in this column. The number of items, our group average across the whole cohort, that's what you're seeing here. These color-coded areas are related to the specific student. And then this is the difference in the individual student's performance level versus the cohort or the class. So pairing this report that you're seeing here from ExamSoft, pairing that with the diagnostic report that I described, that really engages the student in the self-remediation process. And importantly, it really increases their confidence in key areas in which they might need to remediate prior to taking boards. So this is really important as far as an understanding or a lack of understanding of concepts across the curriculum. So up to this point, we've really focused a lot of our attention on remediation of individual students, but I also wanted to show you how we can provide remediation efforts for an entire cohort if it would be necessary. So this report that you're seeing here is provided to our faculty at the end of each academic year, and it allows us to see trends and patterns in student performance, but it's across cohorts rather than looking at individual students. So what this would support, if necessary, is remediation in the form of concept review for an entire cohort. So for example, in this report, I'll just pick one area out. If we look at histology, for example, if we follow, again, it's cohort-based, so you're looking at each cohort, 17 and 18 items, and then the average performance, which is the important piece here. So if you look at histology, for example, you'll see a drop there from class of 17 to 18. So what we did in that area, we recognized that we might need to review these concepts early in the following year to provide students with the foundation that they need to be successful in that area of the curriculum. So at the cohort level, there was a remediation process that occurred to ensure that that piece was reviewed and that students were competent in that area before moving forward. Eventually, this also led to a change in how our histology curriculum is delivered overall, but the main point here is that remediation via curricular review can occur to support all students in a given cohort rather than just focusing on a single student. So I just wanted to provide that example as well. And now I'd like to discuss some outcomes of these processes that we've just covered. So what this has led to is a desire for ongoing opportunities to self-remediate. Self-remediation is often the preferred method, especially for busy students in medical school, but I'm assuming that's likely true of students in other disciplines as well. And as I noted previously, this is not true of all students. There are some students who will be far more successful working with faculty, having constant meetings with faculty in a structured way. All of that might be important for certain students, but as the literature indicated in an early slide, self-remediation, we know, can lead to large gains. So it's important that we help facilitate that process with students. Secondly, we're receiving a lot of positive feedback from students regarding the utility of the reports that I've shown you. And it really is helping them prepare for remediation efforts and stay engaged in that process. And next, students really do have an appreciation of interactions with the Student Progress Committee. I think in many, or oftentimes, students perceive that as a negative experience. However, not all students see it that way. They view it as a time to interact and receive advice, recommendations, study recommendations for them from faculty and administrators. And one note about our committee is it's not purely a faculty committee. So I, as the Director of Assessment, sit on that committee, as well as our Assistant Dean of Student Affairs. So it really is a time for students to sit down with that group and get advice from some experts in the area and talk about opportunities for improvement and what they can do in the area of remediation. And then lastly, of course, this process is always under refinement. That feedback from students we receive, the feedback from faculty, lessons we've learned through the process, that's constant. But importantly, students have to be part of this process at all levels. They need to be continuously engaged, and that includes self-remediation, working with faculty and course directors, meeting with student progress if necessary, and then ultimately, if it's necessary, meeting with the dean to talk about how to remediate if students are on probation. So students have to be collaborators, and they have to really be drivers in this process. Before we move on to the Q&A portion, I wanted to leave with some parting thoughts just to really summarize what we've talked about thus far, and hopefully this will then lead us into a nice question and answer session in the following slide. I've mentioned several times it's a collaborative process. I won't mention too much more about that, but again, all of these processes were involved with the help and the feedback of our key stakeholders, of our students and our faculty. Next, it's really important, in order to support effective remediation, it's really important to collect assessment data across the curriculum. So I focused a lot of those reports on our discipline areas, but any of those reports could be pulled on any of those categories or learning outcome areas that we have decided to track across the curriculum. So it's really important to look at that longitudinal tracking piece in the final reports, especially if students are taking things like boards exams or a capstone exam prior to finishing a program. And students, of course, need a comprehensive assessment data to self-remediate. Those strengths and opportunities reports are important, but those are snapshots of that one assessment level rather than giving them a full or comprehensive view of their full performance like we can do for the full curriculum regarding those concept understandings. And then lastly, remediation data is easily accessible if you develop a standard set of learning outcomes and you really track those throughout the curriculum. Our model is a lot of work up front. I'll be honest about that. It takes a lot of tracking of those components when exams are built or when practical assessments are built. But when you really need to pull the data from the system and report information to students, it makes that fairly easy and accessible for faculty and for assessment professionals. So those are just some key parting thoughts that I wanted to share before we move on to question and answer. So I have added my references and my contact info to the slides, but for right now, we'll just focus on any questions you may have related to the content thus far.
Well, thank you very much, Dr. Zahl, for that presentation. We have a few questions sitting here right now. I just want to give out everybody a quick reminder that if you have any questions, feel free to input them on the right-hand side of your screen under the questions tab. So we'll start off here. Excuse me. So the first question we have is, how does the college assure that each item is coded appropriately in all domains?
What we do is, now I don't know that this always ensures that it's exactly correct. Mistakes happen. But our process is that faculty work with our coordinator of exams, and we use a form that we've developed in collaboration with another school, a form in which faculty add questions, and then they have drop-down menus to add these specific categories. Those categories are required, so new examination items cannot be submitted to us unless they are categorized appropriately. So that helps with that process. On the back end, if there are any pieces that need to be added later, each course director or faculty member will receive an Excel spreadsheet of any missing information so that those categories can be updated later. So it doesn't necessarily ensure that all of them are exactly correct, but I think those two mechanisms that we have in place support clarity and accuracy of those items the best we can, and to the extent that we can as far as our model goes.
Thank you. We'll move on to the next question we have here. How do you track professionalism outside of a multi-choice question regarding pro? For example, how do you track unprofessional behavior regarding classroom behavior, etc.?
Outside of this system? Or I'll answer it on how I think the question was posed, and if I'm not answering what you're requesting, please feel free to pose another question. So we track that primarily in our practical examinations, so our exams in clinical settings for which we use rubrics. That professionalism is a piece of those assessments. However, if the question is asking about how we track professionalism across the curriculum for the purposes of student progress, which I think is what you're asking, we have a survey in a system we use. It's Qualtrics, but any survey system you could use. It's a way that, so all of our faculty and staff have access to this. So if they would like to report a professionalism concern or a commendation, so it can be both positive or negative, if they would like to report that, they just submit it to the system, and then that system collects that information, and then it's reviewed by our academic progress committee, our student progress committee. So that would become a part of each student's record. And importantly, within that form, the faculty or staff member who's doing the report must tell us if he or she has spoken with the student about the concern or commendation. That way we will know if it's already been addressed or if it needs to be addressed for the first time in the Student Progress Committee. So hopefully I answered that question for you.
Thank you. Our next question we have here is, have you noticed any difference between self-remediation between students with learning disabilities?
Yes, I would say that is certainly an area that, and I can't say this across the board, and I certainly can't say it applies to all of our accommodation students, but I would say in that group of students, there are many more students who need a little bit more of that focused, individualized process, working continuously with an advisor or a faculty member, or probably both. So that tailored plan of having regular meetings with faculty becomes really important. And that way you can really give them specialized or individualized support in order to help them along the way with remediation.
Thank you very much. Our next question here is, how do you run a strengths and opportunities report?
That is an option in ExamSoft, and I believe there might be, actually I know there are some guides in the ExamSoft library or in the portal that could guide you through that process, but it's a process in which you choose that report, you choose the areas that are released to students, and then releasing that to students would just allow them to go into the system and view that report on their own. And so that facilitates either self-remediation, or they could bring that report in and print it or pull it up and share it with an advisor or a faculty member. But it's really in the results area and report area in ExamSoft, and if you search it in the library there's a nice guide to help you through that.
Thank you very much. Our next question we have here is, what are the biggest obstacles you've encountered with self-remediation?
I don't know if I can say there are some that are larger than others, but there's always a risk that a student isn't necessarily remediating properly, or he or she overestimates their remediation efforts and really thinks that they are now competent in an area that they have remediated, and potentially that could be untrue. But I think for a lot of students, at least the students that we interact with here in the College of Osteopathic Medicine, I think they're fairly aware already of their strengths and their weaknesses when they leave an exam. And so I think that report really just emphasizes what they already know, that either they do know or they know that they don't know. But again, there's always the risk of a student remediating, and one, remediating the wrong things related to that topic, or one, not remediating to a high enough level to really understand a concept. And so I think the reports that I shared with you today, when all of those components are combined, it gives students a more holistic picture of understanding of concepts across the entire curriculum, so that, let's say, if they self-remediate given one strengths and improvement opportunities report, if they pair that with the other reports that are course level related and concept related, that will really help them understand if they have actually improved over the process of a course, or if they have actually improved over the process of a curriculum in years 1 and 2.
Thank you very Thank you very much. We have a follow-up question here to our earlier question we had on tagging the different items. Okay. This question is, you mentioned that your faculty has to submit a form to the coordinator of exams to add an exam item. Does this mean that faculty are unable to add items to ExamSoft on their own?
New items, that's correct. Once items are in the system, there are faculty who are in that system modifying those questions, reusing that question, doing whatever they need to do based on item level statistics. However, that's not true of all faculty, so we facilitate trainings for new faculty around the system, and until a faculty member has had that training, the level of access might be lower than some of our faculty who are very well versed in the system. But yes, when new questions are submitted, those should all go through the form in order to ensure that those categories are in the system and ready to go prior to actually allowing them in there to review statistics and manipulate items within ExamSoft. And I know there are many different models of faculty comfort in the system, as well as faculty building their own exams in the system. And I've heard things positively and negatively both ways, but that's the model that we use.
Thank you very much. Our next question we have here is, do you subscribe or pay for any specific remediation products such as Firecracker, UWorld, or other? And can you comment on the pros and cons of doing so?
We actually do not purchase any of those. Everything we do is based on reports that we pull in exams. Now, I don't know if students do any of that on their own, but at the level of the College of Osteopathic Medicine, we do not purchase any of that software.
Awesome, thank you. Our next question we have here is, how do you assess that the student has self-remediated properly?
Well, I think that's where the additional reports come into play. We don't have a formal mechanism of going back to each student and ensuring that a student has self-remediated other than students who are taking a full remediation exam in the summer. Also, those courses that have the remediation exams embedded in the course, like anatomy I used, for example, that of course would be a formal assessment to ensure that a student has remediated properly, as well as a formal remediation exam that would take place in the summer. However, if a student is in one of those courses that does not allow a formal remediation until they get to that summer exam, it really is just through conversation with a course director at that point and meeting with faculty to make sure they understand concepts, to assess their comfort level and their knowledge level with concepts. But I think the true assessment is when they remediate via that course remediation in the summer. I mean, that will be the true test of their performance on each of those course concepts.
Thank you very much. Our next question we have here is, we meet a lot of resistance from faculty when trying to get them to tag test items. How were you able to get your faculty on board?
Well, it's been a process. It's certainly a process of developing an assessment culture, is the way we always describe it. But there are still some people who resist that process. But I think the best thing I could say about that, or perhaps the best advice or recommendation I could give, is what we've done is used data requests to facilitate that process. So for example, if we have a faculty member who comes in and asks for, let's say, we'll use that histology example about the categories. So several faculty were concerned and they said, we really want to see how our students are doing in histology across the curriculum. And that's an opportunity for us at that time when we were not using this form. It was an opportunity for us to say, well, only 60% of your exam items are categorized. And so any data that I provide to you isn't really going to be accurate or clean data. So let's work together to get some of those items cleaned up, and then we'll be able to have an accurate representation of how students are actually doing. So when I say that, I think what I'm describing is that data requests have led to eventually cleaner data, because when they're really looking for an answer to an assessment question like that, we really want to make sure that we're giving accurate data back. So it's certainly been a process, and I would say there are still faculty who are resistant, but when they can see the outcome of sharing that data with them, especially on an annual basis, and seeing, hey, we still have 20% of items that are not coded in XYZ course, that's really influencing the data output. So I think that has helped us by helping our faculty understand that in order to get clean data out, we have to put data in that's accurate. But it's still a process. We don't have full compliance, but we're getting better, is how I'll leave it.
Thank you very much. We have one last question in here. They just kind of want you to talk a bit about best practices for remediation process and which ones are your kind of go-to.
I think in general, at a high level, I think, I mentioned collaboration so much, but I think that has really created a lot more buy-in from our stakeholders around remediation. And we're not doing this perfectly. I don't want to give that impression. We still have work to do and we're still refining. But I think one best practice is certainly involving those stakeholders. For example, that third report you saw around concepts across years 1 and 2 of the curriculum, our exam coordinator actually invited many students to come in and chat with her individually about the usefulness of that report, what we could do to improve it, what would make it better, what would not be useful. And then she really edited that report based on all of that aggregate student feedback before actually releasing it to the full class. So that's certainly one best practice, is engaging your stakeholders over time and ensuring that they will find this useful, because then they will use it. Not everyone, but more people will use it if you have that buy-in. So that's certainly a best practice. One of the other components that I think is really important that we touched on just ever so briefly during the presentation is advisor training and some faculty discussions about how to work with students. We have roundtables that we have for faculty to share best practices with each other around advising, what's working for their students, how they contact their students, how they maintain regular meetings with their students, and what those outcomes are. So I think that regular faculty engagement, conversation, faculty development around this topic and sharing best practices with each other is also a general best practice to continue to have these ongoing conversations so that we can all get better at this over time.
Perfect. Well, I just want to thank you very much for your time today and this wonderful presentation. Just a reminder for today's presentation that a recording will be sent out to all registrants and attendees in the next few business days. Oh, we have one more question that just came through. So this last question, any ideas about the best way to remediate for OSCEs or other clinical performance exams?
Yeah, if we think about that specifically, rather than just the multiple choice or the high level, what we do for most of those practical assessments or OSCEs is our course directors sit down and review all of the data from those assessments to look at different statistics and look at grader analysis and look to see if there are specific concepts that students struggled with individually as well as on the cohort level. They will actually develop tailored exams for those students to ensure that they are competent in given areas. And so I think that is key, and allowing students to come in and remediate and have conversations with them. So it's similar to multiple choice, but it's different since it covers different concepts like communication, professionalism, empathy, because sometimes it feels like it's harder to move a student through higher levels of that, whereas with a pure biomedical course, it's content that tends to be a little bit more black and white. But I think it's still similar in the regard that you still meet with a student in an ongoing fashion to ensure that that student is understanding what it is that they need to address to move forward and to improve, even though the discussion around how to improve patient communication is different from a concept in biomedical. I think the actual premise and the conversation looks very similar, even though the content is different. So we're still pulling that data. We're still having conversations with that student in an ongoing way to ensure that they reach levels of competency.
Perfect. Well, thank you again so much for your time. Everybody that attended the webinar will be getting a recording. Also, just a quick reminder again about at the conclusion of this webinar, you'll get a quick pop-up survey. If we can just encourage everyone to fill this out, it helps us provide relevant content for all of our presentations and for you. With that said, thank you very much. I hope everybody enjoys the rest of their day.
Thank you. Have a great day, everybody.